Okay, ladies and gentlemen, a warm welcome to all who have joined this webinar today on the occasion of World Toilet Day. Just a reminder, this webinar is being recorded, so anyone who doesn't like to be part of a recording would have to make a tough choice now and leave. Otherwise, the recording is on. We also have a few housekeeping things to mention first. The recording will be made available, of course, after the session. Everyone who is on the webinar, please turn off your microphones and also turn off your videos so that we can all focus on the panelists. And the panelists can turn on their videos whenever they are speaking or when they are in the discussion. We also have the option, the possibility to for the audience to ask questions. Please use the chat function. The questions will be considered. Some may be answered in the chat in writing. Others may be passed on, if time allows, to the panelists, depending on where we are in our discussion. So we can start. I see that there are still people coming in, joining the session. I think it's good to go. So, you know, the World Toilet Day was initiated by the World Toilet Organization. Its founder, Jack Sim, in Singapore in 2001. It was just in 2013 that the United Nations decided to make World Toilet Day part of the official UN commemorative days, and that greatly amplified the impact and the scope of actions during that day. And on this occasion, this year, GIZ brings together the momentum around World Toilet Day with the increasing global attention for the concept of One Health. So this webinar is organized and hosted by GIZ, the German Development Corporation, as a partner of the Sustainable Sanitation Alliance, SuSanA. And in this, they have closely collaborated with 3 sector initiatives and programs of GIZ. One is the sector initiative One Health. We will hear more about their work very shortly. The global program for pandemic prevention and response, One Health, and the sector program Water Policy Innovation for Resilience. So these are the ones that bring you or brought the program together for today. I will be your moderator and host for the event. My name is Habib Benzian. I'm a research professor at New York University. And I've been working with GIZ and many other organizations in the area of WASH and One Health for a number of years now. Very pleased to take you through the agenda of today. First, we will hear from the Federal Ministry of Economic Cooperation and Development on their new One Health strategy. Then we will have a keynote which will take us through the highlights and the scope of areas that are part of One Health. In the next section, we will get highlights of 3 different programs and their work in One Health and WASH. And then we move on to a panel discussion, and we'll finish with closing remarks in a good hour and 10 minutes. So the idea of One Health brings together the spheres of human, animal, and environmental health to explore synergies and overlaps. And the idea is also to advance the joint agenda of protecting health, well-being, and sustainable development. Not long ago, on November 3rd, the community celebrated World One Health Day. And we have expanded concepts of planetary health, issues of climate change, and even under the current COVID-19 pandemic, numerous other initiatives highlight the increasing interdependency of different areas that were traditionally considered as separate and independent. So if this sounds a little bit confusing and so many different things coming together under One Health, and what does this have to do with WASH and World Toilet Day? This is exactly what we want to clarify today, to explore and help you understand. The title of this webinar already, One Health and the Power of WASH, gives you a hint about the general strategic direction of our discussion today. We believe that sanitation and WASH have a foundational role to play in One Health. So today we have invited a group of experts and practitioners who will take us through different aspects related to One Health. You will hear from one of the world's leading experts on One Health to set the scene for us in the bigger context of things. But to get us started, I would first like to introduce to you Dr. Daniel Eibach from the German Federal Ministry of Economic Cooperation and Development, the BMZ. Dr. Eibach, he's a medical doctor and specialist in tropical medicine, microbiology, virology, and infectious diseases. And he has extensive experience in research, academia, and policy spanning many countries. He serves as a senior policy officer for One Health, antimicrobial resistance, neglected tropical diseases at the ministry. And he's part of the core team conceptualizing the new strategic focus on One Health of the German development of the ministry. Dr. Eibach, welcome to the webinar. The floor is yours.
Yes, thank you very much, Habib. I would also like to welcome everybody to this session on behalf of the German Federal Ministry for Economic Cooperation and Development. When mentioning this World Toilet Day to friends in the last couple of days, this has been rather met with disbelief or laughs, I think. And I realized somehow that how much this power of WASH, as you put it in your session title, is still a bit underestimated in the general public. And but even some experts, I think, seem to be surprised during the pandemic by the impact which hygiene measures can have. I think as the power of wearing masks, for example, was actually very much underestimated, definitely in Germany. And I think wearing masks, for example, has not only helped to reduce COVID numbers, but it actually contributed to the non-existence of any influenza season last winter. And it's definitely shown us which health risks we are, under normal circumstances, willing to accept, although like cheap public health measures are available. And I think in previous years, nobody has worn any mask to protect him or herself from influenza. And there's never been any recommendation to do so for risk groups. And I think the pandemic has clearly shown us prevention is better and it's much more cost effective than cure. And this is not only true for respiratory tract infections, but also for infections which are transmitted via water sources or a fecal oral route. And this means the provision of clean water and sanitation facilities is really a crucial part in our fight against like zoonotic, anthropootic infections and against many neglected tropical diseases as well. And let's not forget, we are in the middle of the World Antimicrobial Awareness Week right now. Just started, and a large number of antimicrobial resistances are spread when hygienic precautions are not properly implemented in hospitals or on farms or where sanitation facilities are not present as in many parts of the world. So in our BMZ One Health strategy, which was just published beginning of this year, we have put a focus on exactly these three thematic areas: the prevention of zoonotic diseases, of neglected tropical diseases, and antimicrobial resistances. And with the strategy, we aim to strengthen health systems in more holistic way rather than focusing on specific disease programs. And here is, I think, where WASH has its important role. Let's take NTDs, for example. And we do not just want to support mass drug administration for a single neglected tropical disease, but include the preventive aspects as well, meaning to build up sanitation facilities, provide clean water sources, but also improve, for example, surveillance, mapping capacities, and vector control. which then contribute not only to a single disease, but much more broadly to a wide range of infections. And a couple of years back, when I was coordinating research projects on the transmission of cryptosporidiosis in sub-Saharan Africa, I've been asked at a conference, why are you doing all this research? And if the solution is so easy, it just improves the sanitation facilities and you will get rid of the disease. Yeah, of course, it's easier said than done, and yes and no. I think it's not only WASH which is saving our world from the diseases, but it's part of it. And we have very good tools in our hands to successfully improve health. And we need to put the different pieces of the puzzle, the different disciplines together, from research to mass drug administration, from surveillance to vector control, and to WASH activities as well. And then, we need this to successfully implement interdisciplinary One Health approach. So therefore, I'm looking very much forward to the upcoming presentations to learn how this WASH and One Health approaches can be implemented, and very interested to hear the very practical examples. And thank you for the organizers for putting this great panel together. Thank you very much.
Thank you, Daniel. In a normal conference room, this would be the moment for applause. So imagine virtual applause now. Thank you for highlighting the new ministry strategy on One Health. And as you said, it's a puzzle. It's different pieces that come together in a systemic systems way. And I think we will hear this more often today in other interventions as well, this element of system thinking that we need to take when we think about WASH and One Health and many other areas. So Daniel, please stay with us in case there are further questions towards the end of the panel. I would now like to invite and to welcome Professor Jakob Zinstag from the Swiss Institute of Tropical Medicine and Public Health. He has been leading the research group on human and animal health for almost 15 years and has extensive publication list with numerous offices in international organizations and working groups. In short, he is an institution in One Health, and he has been among the most influential experts contributing to the concept. His keynote will take us through some of the key aspects. We dive into some practical examples of One Health programs. Please give Professor Zinstag a warm virtual welcome.
Thank you very much, Habib Benzian. Can you hear me? Good. So I'm very, very pleased to talk to you. I'm representing the Swiss Tropical and Public Health Institute, and in the name of Swiss CPH, I would like to acknowledge excellent history of collaboration with GIZ, and even actually we have a collaborative program in Guatemala. In turn, we have also trained some staff that are now working with you. So it's a give and take, and I'm very, very pleased to be with you today. The next slide, please. So I would like to start on with explaining what we understand as One Health, and I would like to give you an example of One Health from rabies control, not because rabies is a particularly WASH-related topic, but the importance is that we show that interventions in reservoirs or interventions in the environment and WASH are at the end more profitable and less costly than continuous focus just on human treatment. Then I would also like to present you what we mean about transdisciplinarity, that we really engage between academic and non-academic actors. But then I would like to walk you through four main topics that are WASH and One Health related. The first is actually integrated approaches to environmental sanitation and nutrient cycling, antimicrobial resistance, and then two specific parasitic zoonosis, Taenia solium and Schistosomiasis. The next slide, please. All that I tell you today is also documented in this book, which is in its second edition. A French version is also available for the first edition, and very newly we have also a Mandarin translation of this book. The next slide, please. So if you don't keep anything from that talk I'm giving to you, please remember this slide here. This is the most important slide. One Health is a systemic approach. So it is absolutely a critical requirement that we recognize the inextricable linkage of humans, animals, and their environment. But that is not sufficient. We consider a sufficient requirement for One Health if we can show an added value or an incremental benefit in terms of health and well-being of humans and animals, or financial savings, or social resilience and environmental sustainability and services from a closer cooperation of human and animal health and other sectors. Doctors and veterinarians can each work in their corners and make animals healthy and humans healthy. And this implies also to the other involved sciences. But if they work together, they can make many more humans and animals healthy and create that added value. And if we cannot show an added value, then One Health is not necessary. But let me now show you an example where we can clearly produce incremental benefit if we work together. Next slide, please. So rabies is a disease that is transmitted from mammalians by the bite of an infected animal to humans. So today, most of the rabies cases are because of rabid dogs in Latin America, Africa, and Southeast Asia. And these, the clinical rabies can be prevented by a post-exposure vaccination. This means after the vaccination, humans can still be protected from dying by a vaccination. But the question is, what about intervening in the reservoir? What would happen if we would vaccinate dogs and interrupt transmission at the root? Next slide, please. So we did this actually. We eliminated rabies in N'Djamena, the capital city of Chad, within 3 months. And we did this by fixed post-vaccination that were mobile, that we moved as soon as no more dogs were around. On this post here, I vaccinated myself 200 dogs in 1 day. Next slide, please. So with the help of an animal-human mathematical transmission model and a subsequent cross-sector economic analysis, we can show that if we concentrate treating only humans that are exposed, then we obtain the dotted line which is named PEP alone. And you see that this curve ever grows, it ever grows. But if we invest in mass vaccination of dogs, that's the black line, we have higher cost at the beginning. But because we interrupt transmission, the incremental growth is less steep than the line on PEP alone. And after 10 years, the cumulative cost of intervention in the reservoir is less than the cumulative cost of interventions in humans alone. So for WASH, this is an essential news because it shows that in the long run, investment in environmental sanitation are likely to pay off, because if you are able to interrupt transmission at the root of neglected tropical disease and other problems, you save more money than if you just keep treating humans that get ill. That's the central message of what I want to convey today. Let us now go to a few examples of that. The next slide, please. Before we go to the examples, a principle and really a theoretical foundation of our work is that we do not just work alone as academic experts. We clearly engage with non-academic experts from the community and the authorities. We value the knowledge of any stakeholder. Often our community partners are not academically trained, but they are excellent empirical experts. They have a lot of observational knowledge. So we bring together not only interdisciplinary competence between academic disciplines, but also we work in a transdisciplinary way, co-producing transformational knowledge between academic and non-academic knowledge for improved and locally adapted interventions. Next slide, please. And of course, this is an important emerging career profile. Young scientists that are not only good experts, but are able to work in interdisciplinary projects and are socially competent to engage with community and authorities. Next slide, please. So this is how it looks like. If you can just click 3 times, then we have all the legends going together. So you see, we bring together authorities, decision makers, academic, specialists, scientists, and the concerned population here under one tent on the left side in Chad and on the right side 100 kilometers north of Chad. And the advantage is if you bring together the most important stakeholders, you leapfrog decision making because you are much faster in finding consensus on problem solving. I am the president of the Transdisciplinary Network of the Swiss Academies, and you see the transdisciplinarity.ch website, which is packed full with toolboxes on how to do such meetings. This is not trivial and it has many risks, but it is absolutely possible. And the success of our past projects and ongoing projects is because we engage with communities and authorities at the outset of new projects. Next slide. Now we come really in medias res, and I'm summarizing this book chapter, which is in our book currently. I had just a conversation with Hung Nguyen Viet, who is at ILRI in Nairobi at the moment, and we summarize this book chapter here. Next example. Together with Hung Nguyen, we worked in Vietnam, and the Vietnamese are probably the world leaders in recycling of nutrients. So they use animal waste and human waste for the agricultural production and also for biogas production and other benefits. But this is a high risk for human and animal health because human and animal waste is often packed with parasites and bacteria that can be harmful. So how can we maintain nutrient recycling while we are reducing the risk for human health? Next slide. So we developed an integrated research method where we bring together health research, for which we can use, for example, quantitative microbial risk assessment with material flow assessment and a social, cultural, and economical assessment. And in this way, we can identify critical control points of human and animal risk for disease. And if we do this with communities and authorities, we get into an intervention cycle where we have iterations of such studies with interventions, and we can subsequently find out what are the most important places in a system to be controlled. Next slide. Here you just see an example of the material flow in an agricultural system with agricultural production, but also livestock production. So you see the flows of nutrients between the pig, poultry, and fish pond, and also the paddies, the rice paddies, and also the households. I don't go into details, but the successful intervention is shown on the next slide, where we are co-composting human and animal waste in Vietnam to reduce the load of parasites and of bacteria that are potentially harmful in nutrient recycling. Next slide. Another important area is antimicrobial resistance surveillance. And here the Canadians are at the forefront. They have a completely integrated antimicrobial resistance surveillance system, the so-called CPARS. And you see that the water and sanitation is an integral part of the surveillance of antimicrobial resistance in the whole social ecological system. Next slide. We have analyzed in a systematic review more than 10,000 papers on the circulation of antimicrobial resistance in Africa. And we found only about 18 studies that really involved humans, animals, the sanitation system, and the whole environment. Only the green arrows, for the green arrows, we have evidence that antimicrobial resistance is really shared and distributed. But for all the red lines, we don't have any evidence so far because the studies are incomplete. But very, very few people do really this kind of integrated research that would allow a systemic assessment of the circulation and spread of antimicrobial resistance in the social ecological systems. I have submitted such a project to the ERC, the European Commission, and to the Swiss National Science Foundation, and these projects were rejected. And they said, we know everything, but that is not true. We know very, very little about the circulation of antimicrobial resistance in the social ecological system and the role of sanitation. You see here a pond in our study area in the Somali region of Ethiopia, where people fetch drinking water and animals are also drinking. So you have a direct interaction of antimicrobial resistance between humans and animals and the water and sanitation system. Next slide. So the two parasitic zoonoses that I would like to discuss here is cysticercosis on one hand. This is the pig tapeworm, and what keeps the cycle going is open defecation. So if people defecate in the open environment and pigs are roaming free, then the cycle is closed. And humans are at risk for direct infection from meat consumption, but also from unclean contact with their own feces, which can lead to cysticercosis, also to brain infection. Next slide. So here you see examples from our study sites in Mali, where you see free roaming pigs, and there is a lot of open defecations. And the solutions to that are on the right side. So if we can make villages certified open defecation free, and if we would keep the pigs in stables, then we could cut that cycle. Cysticercosis, which is still prevailing in many countries of the world. So sanitation plays a pivotal role in a One Health approach at the root. Next slide. So a similar problem is schistosomiasis. I mean, schistosomiasis is transmitted through being exposed in the water to infectious larvae, and because people urinate and defecate in the water. And here again, I mean, we can keep treating humans forever with praziquantel, but we could solve the problem probably at medium term if we come to a behavior change of no longer open defecating. Work in this long-term engagement, but organizations like GIZ should really engage also in the solution at the root. Next slide. So we conclude that the One Health approach applied to WASH can demonstrate that environmental sanitation as an intervention at the source is less costly than human medical treatment for parasitic zoonosis, can probably a problem for to reduce antimicrobial resistance, and can contribute to safe nutrient cycling. But we need more research to really show the economics of these interventions at the roots, like we did it for rabies and also other zoonoses. I thank you very much for your attention.
Thank you, Professor Zinstag. Fascinating presentation and very powerful examples showing how cost-effective it is to go downstream, to go to the root of the problem tree to tackle those problems. And this is about the environment and not about giving humans more pills to eliminate the worms in the once they have entered the human body. So prevention, as we heard before, is crucial. But you also showed very well that we should take a holistic view of One Health and not just the human-centered point of view. There's a big aspect from the environment and the animal sphere that we need to really take into account. So thank you again. And we'll get back to some of the things that you mentioned in your slides. So the next part of this webinar is a section where we, for the next 20-25 minutes, we have invited a diverse group of practitioners who will talk about their work in the context of One Health and WASH. Before we move on, allow me a very brief disclaimer first. The organizers had put together a very diverse panel of speakers, but due to the multitude of events and activities around World Toilet Day, they were facing several last-minute cancellations. And as a result, and in contrast to GIZ's principles of diversity and equal representation, this panel only features male speakers due to the circumstances. So we hope for your kind understanding in this specific situation. Our first panelist is Maurice Konyeki-Boye from Vétérinaires Sans Frontières. He's based in Nairobi, where he is the country director for Kenya and Somalia. Maurice is an accomplished community development practitioner with a distinguished leadership and management career focusing on pastoral development spanning over 20 years. He has been actively involved in design, management, and implementation of integrated food security, livestock health, community empowerment, and resilience building programs to cope with the effects of climate change around the Greater Horn of Africa. Maurice also holds too many degrees actually to mention them all here. All are related to environmental science and animal health. Maurice, we are really happy to have you on board, and we are curious to learn more about Vétérinaires Sans Frontières and your work. Please, the floor is yours.
Thank you very much, Professor Habib, plus colleagues on this forum. I'm happy to learn and share the experiences from various parts of the world, pointing to one common goal: how can we make One Health work? A bit of introduction on VSF Germany is an NGO with headquarters in Germany. We are a member of the VSF International, but all VSFs work independently. We are based in Kenya with a regional office and working in 6 countries: Uganda, Ethiopia, Sudan, Somalia, and Kenya. On this particular day, I think we have come to discuss a point which has really given the world today a big of shake, how to bring people to work together on what is called One Health. To start it off, move to next slide. Yeah, I looked at what can really make us work as a team, and going by what we have been doing in the field, working with the communities and working with research institutions, experts, and many other people at different levels, I found that we need to come to a point where we see the interactions between humans and animals and environment. You look at one of the pictures we have there from one of our locations, water, humans, and animals are just at one point. And understanding of how this interaction helps them, affects them in one way or the other would be very important to us. The next picture shows how people in different parts of the world exist in their environments, and therefore this brings us to a need to understand the social ecological systems which influence health-seeking behavior and practices. And I think that would be very important today as we look at the World Toilet Day and we find out hygiene and sanitation and streets. So as we work in various sections of the world, understanding of the local context is very important as we introduce the One Health concept. Because look at these people moving with their livestock. These are purely pastoralists. And you tell them about hygiene and sanitation. First, water is a major deficit in this area. And for us to maintain good hygiene, we require water. And then when you look at the people moving there, what is their priority? Is it water for washing their bodies, being clean, or the water for livestock? So these are questions as we work and we design our programs are really critical for us to really let us understand. And therefore, these are the things I've been taking into consideration. Next slide. Yes, this brings me to another aspect that many times we talk of One Health at very high level, very high level, scientific, research-based, and beautiful. And I think that is the essence making us to see that there is a gap. But as we do this at the ground level, what knowledge or awareness does exist so that people relate some of the diseases they go through with their practices? And therefore, in my designing of our programs, we have come to see that creating awareness and education that link the practices, zoonotic diseases we find in our areas and the environment. What is the linkage? For example, the team we have seen there moving the animals, they are very much about zoonotic diseases. They are very much aware. They know. But to link this with the environment, to link this, it requires a lot of awareness and education. And of course, we put a lot of effort in the interventions, but sometimes we don't achieve much. So what is key here is that as we design our interventions, are they relevant to the national health, veterinary, and environmental frameworks? In different countries, we have these three key departments or sectors working in isolation and having different frameworks. So as we design our programs, are we looking at this, the relevance that we have? Because to bring the three different sectors together, they must see a common goal in what they are doing in relation to the national output, the national goal for that particular sector. And so these are some of the fundamental issues that we really have to put in place to enable us have our One Health translated from just an idea, a concept outside there, until the people on the ground, the government in power, because every aspect of our interventions is subject to the government saying this is relevant to our development policy or development framework. So these are some of the things that we look to that. I think probably I will move to the challenges which I need to put in this. So I will stop there, and probably when we come to give the questions, I can answer the challenges as given to me by Habib. Thank you.
Thank you, Maurice. Wonderful transition. Thanks for highlighting again system thinking and for also including the social and ecological systems, which is really, really relevant. We'll definitely get back to this aspect. Thank you. Our next speaker is Dr. Michael Köberlein. Michael, if we speak English, from GIZ. He works in the so-called Sanitation for Millions program, where he is developing the concept of wash-in healthcare facilities in the context of the new focus on One Health that Dr. Eibach from the ministry described at the beginning. Michael also has prepared a few slides for all of us. Please, Michael, the microphone is yours.
Okay, thank you, Habib, for introducing me. So please move forward to the next slide. So as Habib has said, I'm working for the global program Sanitation for Millions, which is working in 14 countries, funded by 5 donors and dealing on access to safe sanitation and hygiene. So this is our core goal and objective, and we are commissioned by the sister division of Mr. Eibach from Division 103 in BMZ. So One Health really also matters for Sanitation for Millions. Yes, we actually started to work on this issue before the One Health strategy already was introduced by the BMZ, because in 2019, the World Health Assembly passed a resolution where all member countries committed to universal water, sanitation, and hygiene in healthcare facilities. So this is actually our point of departure, coming from the wash sector, dealing with the situation in washing healthcare facilities. So we work with small units, with clinics, and also large hospitals. So it's a whole range of healthcare facilities we deal with. And as you see here, I don't want to go to the details. The global data show that there's really a pathetic wash situation in many partner countries when it comes to washing healthcare facilities. And this is, why the WHO has really made it a priority in their work and have started an initiative, which also was then important, when it came 2020 to the pandemic situation with COVID-19 and Corona, because washing healthcare facilities matters a lot, So without functioning healthcare facilities, you will not find a solution in any of the countries. And this is in the end why we addressed also One Health in washing healthcare facilities. Please, next slide. Well, coming from the perspective of WASH, the thing is we had to start to conceptualize this topic. And since healthcare facilities are very complex utilities, it is important for us at the WASH sector to deal with the interfaces to other sectors, which are mainly the health sector, the waste sector, and also the environmental sector. So when you look at these issues, which are the parameters given by WHO for safe wash at healthcare facilities, we have to deal, with excreta, with wastewater, with healthcare waste, with the control of vector-borne diseases, and so on. So the parameters actually already showed us, in the end, we have to enlarge our approach. We have to look at the interfaces of other sectors and really have this holistic approach, what also Professor Sinstag has actually talked about, because otherwise you never will get safe wash at healthcare facilities. Next slide, please. So where did we actually start at? The thing is, as also said before, we looked through the eyes of One Health, and we looked at the entire system in which health risks and diseases can develop and spread. But how to operationalize this? So we started actually to operationalize One Health, when we had a focus on preventive measures to protect human health, of course, and to reduce the health risk as such. So we looked at the people at risk, when you see at the healthcare facilities, and there are different stakeholders, different actors, and they need different kind of preventive measures to really be safe and to really be protected, from let's say all these health risks. So we looked at the medical staff, which has of course different preconditions, especially when it comes for occupational health risks. We looked at the in and the outpatients, like visitors and those people who just come from for a diagnosis, because they can bring diseases from outside, but they also can take diseases, and that's what we looked at. We also looked at the staff at the healthcare facilities, because they are most at risk. When you look at the cleaning staff and the waste pickers who have to deal with the very hazardous waste. And we also looked, at the general public, so to see in the end, what impact does hospitals have in the end, on their locality, to also see, that there's an interlinkage between environmental health risk, public health risk, occupational health risk, and in the end, infection and epidemiological health risk. So these things we all took into consideration. Please, next slide. So what did we do concretely, but we saw in the end, dealing with this hospital, that was really a missing link, and one of the very important issue was not to look at only building toilets and also hand washing facilities, which we do, but one of the core message was really put a stronger focus on safe hygiene, because that really matters, when it comes for health issues and epidemiological issues. So we worked on waste system, we established a system of personal hygiene, we ensured that there's safe hand hygiene in the hospitals, and of course we created awareness, information sharing, so that the people, the staff in the hospitals themselves were able to do, a proper job and to be aware of all the safety measures which are required. Next slide, please. And looking at the impact, the thing is, and I just wanted to give you the example of safe hand hygiene. Nobody thinks, this is an important issue, but when you really look at it, safe hand hygiene really matters a lot. And one of the issue is, that 80% of all the infections are transmitted by hand. So especially in healthcare facilities, you have to care, for safe hand hygiene, because otherwise, the thing is, you never get this problem under control. So what did we do? The thing is, we actually first thought, this is a very cheap and effective measure. That's something we should know. And as per World Bank, for example, study, we should see that an investment in safe hand hygiene amortizes 15 times. So it's really worthwhile putting a focus on this. And what we noticed, we have to create more awareness on the effects of safe hand hygiene, of WASH decision makers and vulnerable groups. As Professor Sindak also said, we have to really inform them and make it clear, that this is an issue which is cost effective and it works. So last slide, please. Next. And as we put an emphasis on this, we started, to design a concept called promoting a culture of proper hand hygiene, because it needs different kind of ideas and approaches. So we started to look at the enabling environments, what can we do there, be it, from just ordinances and hospital rules, but we also constructed hand washing facilities, which often are not available. We looked at different countries, different organizations. What are the best practices, which we can promote and also apply in our partner countries? And last but not least, we were promoting and advocating for safe hand hygiene, because it all deals with behavior change, awareness, and in the end, proper attitude towards the topic. Thanks. So that's thanks.
Thank you, Mark. Thank you. This is your last slide, I see now. Yes, shocking realities from WASH in healthcare. Thanks for highlighting this importance of hand washing, particularly now in the pandemic context, but also very important in the context of antimicrobial resistance, a topic that we will get back to during the discussion, something that is really of concern for many in public health and beyond, and is definitely a One Health topic. So thanks again for this quick overview. Our last speaker is now Benjamin Adrian. He's the initiator of Viva Konagwa. Many of you will know the NGO or some of the projects that it runs in Germany and in various other countries. Benny started as a professional soccer player with the German club St. Pauli in Hamburg before initiating the NGO and other social enterprises. And just as COVID-19 started, he and his family moved to South Africa, helping to establish an operational basis for the NGO in Cape Town. Benny, South Africa, and particularly the province of the Western Cape around Cape Town, are among the most water scarce places in the world. And wash, especially sanitation conditions, are lagging behind for very large parts of the population. Can you tell us more about your wash-related work and your views on One Health?
Yeah, hi Habib. Thank you for inviting me and giving me the chance to talk a little bit about the approach of Viva Konagwa. As you said, of course, water scarcity in the Western Cape was a dramatic problem a few years ago. The positive news is that Cape Town actually adjusted quite well during this crisis, and actually the halved its the usage of water in many areas. So right now it's not as critical as it was before. Where we touch base with our wash projects in South Africa is also more the Eastern Cape, where I can talk more about our own experiences on that side. But maybe to give you a small background of what Viva Konagwa is and where Viva Konagwa comes from. I mean, we are actually, as you said, born out of a grassroots movement in the area of Hamburg, St. Pauli, where we started 15 years ago. Basically, creating a movement around the vision of water for all. We at the beginning were only focused in Germany, basically, then later on Switzerland and Austria, but we were more about campaigning, raising awareness, raising funds for wash projects of our partners. What was always very important for us from the beginning was that we want to differentiate ourselves from the normal, let's say, NGO language, which you can find on the market. So what we used from the beginning was the idea of basically networks, the idea of everybody being able to join the movement and pitching in creative ideas, and the idea of what we call all profit, meaning our approach was always a joyful one. We always wanted to use a positive feeling to inspire, especially young people, in the process of social change, and we wanted to avoid the typical stereotypes where many NGOs are still using to raise funds. You all know the big billboards with poor African children and stuff like that, always repeating also the same stereotype of Africa, which we always wanted to avoid from at the first place. So what we used was always universal languages in order to have our movement going. So we always use music, sports, and arts in order to raise awareness and raise funds. And then the projects were realized through partners, through international partners like Welthungerhilfe in Germany, like Helvetas in Switzerland, also local partners like Orda in Ethiopia and others. So we were not in charge in actually then implementing the projects for quite a long time, because as I maybe just mentioned, we started with a spontaneous idea and then slowly grew into the sector. Yeah, we were not coming from academia, we were not coming from the sector at all. So we slowly grew into it. And over time, of course, we understood not only the importance in our WASH projects of the infrastructural parts, but of course the soft component, the behavioral change part. I mean, we were then also witnessing studies in our project, for example, in Ethiopia, alongside Welthungerhilfe, where we experienced that the post-collection contamination, for example, in regards to the clean water source was a major issue. Yeah, so those come clean out of the well, but until it was used on the household level, it was again contaminated. Yeah, and of course that had several reasons, and everybody is aware about the integration, of course, of not only the clean water but also sanitation and hygiene on that side, and how important it is to work on that. Yeah, behavioral change part, on the soft component, working with the people in order to use the facilities also in the right way. So then that was for us a first insight, okay, like how important that is. That's many years ago, of course. But then what we found out is many of the measurements which were taken in order to tackle that part was and especially in the context of sanitation was, for example, the approach of CLTS, community-led total sanitation. I'm sure you are aware of it, where certain aspects are used, like for example a shame walk. Yeah, where the emotion and the affect of shame and guilt actually are triggered in order to motivate and inspire behavioral change. And that's when we find out actually that's exactly where we wanted to move away from, or where we said, yes, it's working. That's what you can see. But our idea now is, and that's something we now, as we are growing as an organization, want to introduce even more. What is the special Viva Konagwa footprint, maybe also on the project implementation side? And here we can say that in Uganda, for example, but of course, alongside Welthungerhilfe in Uganda, but in South Africa, very much where we the first time implement the projects ourselves. What is important here? It is in the Eastern Cape, a project where we focus on sanitation very much, sanitation and hygiene. The clean water aspect, drinking water aspect is not so important there. And what we can see here is how important actually, or how not so important actually is the infrastructure, because yes, there are toilets, but what you can observe in that context is people are not used to actually use the toilets. There are toilets sometimes. They are functioning, but you see the kids around the toilet and then peeing in the back and just not using it, and that's a deeply rooted, of course, cultural context there, which is one of the major challenges on that side. And what we try now to introduce is what we call the universal language approach for behavioral change, and moving away from shame and guilt as the motivator for behavioral change, especially in the context of young people, of kids. The young generation, not only in South Africa, but all over in the continent, and trying to introduce more inspiring ways of behavioral change. So this is what we're currently also developing, what we are also testing, where we're also trying to bring in a scientific approach, academia approach, to see what is the best methodology in order to tackle the issue of behavioral change and the usage of the infrastructure facilities in an inspiring way, through music, through sports, through art, and all what for us is aligned with what we as Viva Konagwa are as a brand. So I think that's something where we basically more and more getting into, and which is in the future more and more shareable, where we have more and more experiences also contextualized in different African countries. What I also find interesting in it is not only the change of the approach in using joyful means and inspiring ways to get involved with the kids, but also to link through universal languages, link the project contexts and basically the urban hubs of the respective countries. So because you see what we experience is often a disconnect between maybe the potential, the artists and the students, the people in the capital, in the main cities, and the rural areas. Sometimes there are interesting prejudices or viewpoints, perspectives, and we also find it interesting to experience more or explore more even that connection, because obviously when you have local role models, maybe famous artists or football players or what, and you connect it with the project area, you of course on the one side have a very inspiring, role modeling for the kids or the beneficiaries, but you also have people who transport the message and connect it to the urban networks in the capitals, which we find interesting when you look at the civic society development in a holistic way. So yeah, that's what I can share right now, and it's something which we practically are using at the moment, are developing at the moment, and we were trying to share also the best practices and the knowledge between the respective countries. But yes, that's our goal, or our idea is that we want to inspire learning in a joyful and inspiring way, especially for the young generation of the continent and in our project areas.
Thank you, Benny. Your speeches are always inspiring. But of course, your concept and your real life work is also very inspiring, as we see the creation of a movement of social change, as you explained, is something where I think many other programs can definitely learn from your work and benefit from similar ideas and approaches. I think we have heard now a lot of different topics, and I hear repeating themes throughout the contributions of our panelists. Some of that is related to the interface between sectors, but also the interface between research and practice. I hear a lot about behavior change. I hear a lot about the interface between the animal and the human health. Let's explore this a little bit further. Michael, my first question to you. When I'm a patient and I go to a hospital or primary healthcare center, my expectation would be that I'm treated, or that all those health professionals that look after me have the opportunity to wash their hands. Apparently, as you said, 1 in 3 healthcare facilities does not have basic hand washing facilities. Why is this so? And what are some of the underlying reasons? Is it just an infrastructure problem, or are there other problems at hand? We see from the wash in schools, for example, that infrastructure and behavior go hand in hand. You cannot ask someone to wash hands if there's no soap and no wash facility. So in short, what is your view on this in the healthcare context?
Well, in the healthcare context, it's not so very different to the school context. One of the large limitation is, in the end, a lack of budgets within the public authorities to really to operate and maintain all these facilities, be it toilets, be it the hand washing facilities. So it is constructed, but after some time it needs rehabilitation or maintenance, and this is not done. And that's one of the main reasons, we also include, this kind of operational maintenance models and concepts, train the people, and also show, that there are budgets within the public authorities to really take care of this. This is one issue. The second thing in healthcare facilities, what we from the WASH sector always have seen is you often have so-called public health officers. It's medical people, coming from the medical field, having no understanding, let's say, of infrastructure, hardware, technical issues, and accordingly are unable to manage really how can I keep, my hospital at least properly, and how can I, in the end, what is needed to have, let's say, safe wash at the hospital. So that's the second reason. And the third is you have also sometimes, let's say, the lack of let's say, a policy framework. So even in the government institutions, they started either, the public authorities just focusing on infrastructure, on construction, and some others only on medical thing. But what we now have learned also from One Health, we need a comprehensive and holistic approach. We have to come from all fields and put it together, as the WHO has now also brought out in their studies, the different parameters, and interlink it. And only then the whole system will work. And this is, what is the chance of One Health or also of the WHO initiative.
Thank you. Those are all super valid points and sound very similar to broader WASH challenges. It's a nice segue into a question that I had for Maurice, because Maurice, you mentioned in your intervention these challenges of working between sectors. What are some of these challenges and how can they be overcome when you try to work to address a problem involving different sectors?
Okay, thank you, Professor Park. Sorry, I dropped out a bit. We have solved a problem, but the major challenges we see here is that there is a very big divide between the professionals working in the three major components of One Health, the veterinary teams or livestock component, public health or medical people, and the environment. They address the same objective of improving hygiene and sanitation, but the approaches are totally different. And this has got a lot of challenge because if you look, for example, in the veterinary or livestock, I want to improve water. My focus is on livestock in most cases. And you see, if you make this water, for example, a water pan or a dam, this water is going to be used by humans. And once you make it, there is no protection to ensure that the entry of animals is controlled. The animals will come and walk into water, as you saw the dam I was showing you there. And so this approach, the thinking, is something that really brings the challenge in people to work together. And not just because of the training, but you look also at the policies. You are making a dam and you are told you don't care. Once you have made it, your work is to give water to livestock. So these sectoral differences in terms of policies and practices are really a big challenge. Two, when you come to the financing, I've been implementing a One Health approach and I've really been bringing the government departments to try to put together. I've managed to make it in one, what we call a county in Kenya. But this, after 3 years, you try to get these people to come. They say, we don't have money to come and do it. You know, our travel from this point to there must be financed and we don't have the money. So this issue of looking at financing totally different. And you know, this is the same government. Why don't we say that right now, the Ministry of Livestock does not have what money, but because this is a One Health project, can we have their costs scattered for by the Department of Health? And you see, you realize this is not coming through.
It's not so easy, yeah.
And again, we have got also the limited knowledge at the community level. So
you also mentioned in the preparation for the webinar, you mentioned that you have tried to establish intersectoral working groups for One Health, where the different sectors meet regularly, come together and discuss problems and solutions as well. So that might be also one way of overcoming this challenge. Sorry for cutting you short a little bit. It's just because we have only 5 minutes left. I wanted to ask Professor Zinstag, one of the frequently mentioned criticisms of One Health is that people say it is a concept, it's on paper, it's academic. How can we make it real? How can we put it to life? What is your response to that?
Yeah, thank you. First of all, what Maurice said, it's the nerve of the problem, it's finances. And this is why it is so important that you prove the economic benefits of working together. And that's why we need studies that really show the incremental benefit of working together financially. Number one. Number two is start at grassroots. We have started now an integrated human and animal disease surveillance system in one district of the Somali region of Ethiopia. And we don't create a parallel structure. We work with the established health bureau and livestock bureau, and they delegate people to work together. So we do not create parallel institutions, but it's the same institutions that will put it into operation after that work together. So these are the main two lines. First of all, prove the economic benefit, and secondly, work with existing institutions. Don't create anything in parallel. That's a problem of the Swiss cooperation, but also GIZ. You create wonderful systems, and when you finish the project, they collapse. So let us do this with the existing institutions, and we cannot run faster than the existing institutions.
That's a very wise conclusion, and very relevant for many of the development cooperations programs, not to create parallel systems, but to work with the existing ones, make them as strong as possible. That should be the focus. Benny, one final statement from you before we move to the closing part. Just 1 minute take-home message from your side.
Well, I mean, since we are not coming from academia, we are not coming from the governmental side, I would even zoom out a little bit more if we talk about collaboration and how can we bring these theoretical frameworks into life. Of course, we always I think we even should zoom out a little bit more into civic society. How can we connect it to culture? How can we connect it to subcultural movements, to people who move the countries in the urban hubs as well, and also, of course, link it not only between different Pan-African, between different African countries, but also to Europe in order to make exchange and raise awareness in civic society in general about the topic of WASH, about the topic of health and well-being for people in the world. So well, yeah, we try to always zoom out even a little bit more here.
The occasion of World Toilet Day is well chosen for that, I guess. This is a global initiative to raise awareness for all of this. So I think you were summarizing quite nicely. I'm sorry for cutting this discussion short just before it gets interesting. And I see that in the chat there are also questions ongoing. Time is over for our discussion part. I would like to hand over to Ms. Ruth Schumacher from the GIZ Global Pandemic Prevention and Response Program and One Health Program to give some closing reflections. Frau Schumacher, bitte.
Thank you very much, Mr. Benzian, and to everybody, to all the input givers. I think it was a very fruitful discussion today on a topic which is not so much on the topic lines in our everyday discussions on One Health. I would very much like to highlight some of the points which have been discussed today. Collaboration was the essence of most inputs and the discussions, but it's not only a collaboration, as we know, between sectors, which is the base of One Health, but different of the speakers highlighted as well that it's urban-rural, but also academia research with people putting it into practice, and that's where GIZ comes in. And but also NGOs like Benjamin Adrian's, etc. I think it is important for getting One Health and WASH forward to look at what Mr. Zinstag highlighted, that One Health is cost effective and that we really shape our messages so that we can implement One Health in the area of WASH effectively. In all inputs, it was quite amazing. Community played an important role, and you summarized it at the end, start at grassroots, work with people. And I really liked also Mr. Adrian's approach. Be creative, use joyful means, don't be too scientific, but really try to find a language which speaks to people so that we can implement together with the people. So thank you very much to all the speakers and to you, Mr. Benzian. because this is the way forward to implement the BMZ One Health strategy. And the spotlight today was on WASH, but some of the messages, we will take them forward also to the other areas of the One Health strategy. And this has given us, as the putting GIZ and technical cooperation projects, as well as for the financial cooperation, a lot of input for our further actions and reflections. Thank you very much. And back to you, Mr. Benzien.
Thank you, Frau Schumacher, for this perfect summary. You covered it all, brought it nicely back together. Nothing left for me to say other than to hope, express my hope that this webinar has given you some inspiration and gave you a lot of food for thought. Nothing further to do than to wish you a successful World Toilet Day. Thank you very much, everyone. Goodbye.
Goodbye.